One of the big problems with IVF today is that people have very unrealistic expectations after the embryo transfer. Let me explain. You do the IVF cycle, the doctor treats you, makes a good quality embryo. If he's a good doctor, he'll show you a photograph of the embryo, and then he transfers this embryo back into the uterus. And you can see during the ultrasound guided transfer that there was a little flash. So now you have this top quality embryo in your uterus, and the doctors told you the transfer has gone well, the embryo is great quality, your endometrium was receptive, everything is perfect. So, of course, you're going to get pregnant. Sadly, it doesn't work that way. I wish it did because my life would become so simple. Because then our pregnancy rates would be 100%. I wouldn't need to talk to patients. I'd say, hey, give me my money, take your baby. The tragedy is that while we're very, very good at making embryos, once we've transferred an embryo back into the uterus, the embryo implantation process, the in utero process, is a black box over which we have absolutely no control. And patients don't understand that. Hey, you put a top quality embryo, why didn't it implant? And I need to explain to them that implantation is not just a question of putting an embryo back. The embryo transfer is very different from embryo implantation. Embryo transfer is a simple mechanical process of putting a good embryo inside a receptive endometrium. Embryo implantation is a complex biological process which goes on over a period of 10 days, where there's a complex dance between the embryo and the endometrium. The embryo needs to send the right chemical signals, the endometrium needs to accept them. And a lot of this stuff is not in any doctor's control, which is why that 2 week wait can be so terrible. And that's why I remind them that remember, human reproduction is not very efficient. And that's the reason why every fertile couple doesn't get pregnant every month. Because even though the sperm count's good, she's ovulating, the tubes are open, they're having sex regularly, they're most probably forming an embryo, but that embryo is not implanting. And this is just something we need to learn to live with. Now, if you don't get pregnant after having sex in your bedroom, you're not so worried because, hey, guess what? You can have sex the next month. When that embryo we transfer after an IVF cycle doesn't become a baby, not only is it a huge financial setback, it breaks your heart as well. And that's why it's so important to have realistic expectation and to understand what is in your control, what is in the doctor's control, and finally, something which only God can control.